Hi, Mr. Fujimoto. How are you today?
Good.
Good. My name is Tracy. I'm a student nurse with Cal State Long Beach, and I am here today to assess your ears, nose, mouth, and throat. Okay?
Okay.
All right. So, what year is it?
2020.
What street do we live on?
Cerise.
When do you go back to work?
2 days.
Okay. A&O times 3. So we're going to start with your ears. So we're just going to take a look. So we have the tragus here, and this, if you press on it, it'll occlude the ear canal. Also, if you press on it and it's painful, tell me if this hurts, then that is indicative of an infection. So I'm going to take a look in the ear. Tell me if you feel any pain. Okay, so his ears, the size and shape is symmetrical. It seems proportioned to his face. The color is, skin color is consistent with his facial skin color. I don't see any blockages, any drainage, any discharge, any bleeding, no foreign objects in there. Free from infections, lesions, swelling. There's no Darwin's tubercle, no tenderness. So we're going to test your hearing. So the tragus that I just talked about, I'm going to have you occlude the tragus on your left side. And I'm going to whisper something and you repeat it back, okay? 1, 2, 3.
1, 2, 3.
And go ahead and do the other side.
4, 5, 6.
Okay, his hearing is intact. So now I'm going to do the Weber and the Rhine test with our fake tuning fork here. So let me know which ear you hear this in, okay? Pretend.
Both.
Perfect. Weber test is positive. It does not lateralize, so it's good. So now I'm going to put it on your mastered process. Let me know when you stop hearing it, and then I'm going to move it, and then let me know when you stop hearing it again, okay?
Now. 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 Now.
Okay, his Rhine test is good. Air conduction is longer than bone conduction. So now we're going to do the Romberg test. So I'm going to have you stand up. I'm going to have you put your arms at your side, feet together, eyes closed. And we're counting for 20 seconds. All right, you're good. You can open your eyes. You may have a seat. His balance is good. So now we're going to move on to the nose. Just going to feel your nose. And breathe in and out. And again. So it's going to be a bright light. You might want to close your eyes and take a look. Go ahead and tilt your head back for me, please. Okay, you can look. You can put your head down. Okay, so his nose is center midline. It is symmetrical. I don't see any inflammation, deformities. I don't feel any swelling anywhere. There's no discharge, no blood, nothing. His nasal mucosa is red. Looks normal. There's no bleeding, no anything weird. His nostrils are patent. So now I'm going to palpate your sinuses. Let me know if you feel any pain, okay? Okay, I don't feel any enlarged sinuses and is free from pain. So now we are going to take a look at your mouth. See his lips. They're pink. They're a little dry. I don't have gloves, so I'm not going to be touching inside his mouth and moving stuff around. So I'm going to have you go ahead and pull your lip down, Will. And go ahead and pull the top one up. Okay, go ahead and stick out your tongue for me, please. There's no deviation. Go ahead and say ah. And move your tongue to the right and the left. And put it on the roof of your mouth, please. Okay, you're good. So I don't see any lesions. I don't see any deformities, any nodules. His mucosal color is pink, looks completely normal. His tonsils, are 2+. Their uvula, it's all consistent color with the rest of his mucosa. There's no swelling. Cranial nerve 12 is intact. Cranial nerve 10 is intact. And we're all finished, Mr. Fujimoto. Is there anything else I can get you today?
No, thank you.
Okay, thank you. Your call light's here. Let me know if you need me.